This is The Pulse, and I hope you're enjoying yourself with me, Aisha Ibrahim. Now, imagine life as a woman who is leaking urine and fecal matter through your birth canal without control. That's the situation victims of obstetric fistula have to deal with. Tonight, JoyNews' latest documentary travels deep into Ghana's hinterlands to find out more about this condition and explore the challenges in Ghana's maternal healthcare system. And before we go into the dynamics of this, here's a sneak peek of the 30-minute film. Okay, so the man who put together this 30-minute documentary is Justice Baidu, and he joins me in the studio. Good job, Justice.
Thank you very much, Aisha.
You're the man.
Always good to talk to you.
Definitely. We'll do the discussion. Let's take assets of this documentary. All right, we're still trying to bring assets of that documentary, but Justice, tell me about this situation. How severe is the situation?
So every year, 1,300 cases, 1,300 women are diagnosed with obstetric fistula. These are estimate figures from the Ghana Health Service. Obstetric fistula is a very horrific condition that occurs to women who have had obstructed labor. And so women go into labor, they need cesarean section, and they can't get access to these cesarean sections, and they would have to stay in labor sometimes for hours and for days. When these labor conditions get complicated, then fistula develops as a result. Fistula is a result of many causes: early sexual activity as a result of child marriages, and all of that. And so this documentary is set in two regions, the Upper East and Upper West regions, two of the regions that have some of the highest numbers of early marriages. We look at, for example, why women get pregnant for 9 months, and all through the 9 months are unable to get supervised attention from any skilled birth attendant, and also why women are just unable to go to health centers, one, because it is far from where they live, or even when they've been able to make it to these centers, do not have professional health workers at these
It's quite catastrophic to see a woman go through 9 months of pregnancy and then finish with that and go through this fistula.
Yes.
It's so pathetic. Let's look at this assets put together by Justice Baidu.
Inside the local hospital in Boko, a cesarean session on a woman in desperate need. This hospital is located in one of the poorest parts of Ghana. It goes to show how far healthcare delivery here has come. Dr. Clement Opon, an example of a dedicated health workforce offering his expertise where many his like would hardly go. Here he performs more than 3 surgeries every day.
So Upper East has a high population of teenage pregnancies. Okay, I think somewhere in the other parts of the country, teenage pregnancy is seen like a child who has gone to do something. But here, these are married, wedded young girls who require babies. Okay, in my consulting room, I treat patients who are as young as 17, 18, and are still treating infertility, looking for babies. And once these patients are very young and they are carrying babies, labor and delivery is likely to be difficult.
This region already has one of the worst records of maternal mortality, and for some of the women lucky to deliver alive, complications like obstetric fistula occur. Fistula is a childbirth injury which occurs when labor is obstructed and the woman fails to reach emergency care in time.
The patient will be presenting with continuous leakage of urine through their birth canal, through the vagina. As you sit down now, you will be leaking urine continuously, 24 hours, 7 days a week. Morning, afternoon, night, your bed is wet, you never will be dry.
At the OPD, some of the women who live with the horrors of fistula have come for their routine checkup. Most of them married off at tender ages. Hawa Halidu, married at 13. Zainabu Abdullahi, married at 14. Shehu Lar, married at 15. The list goes on and on. They are comforted by Cynthia Sinawisi, herself a fistula survivor, helping other victims to come out.
I lived with it for 2 years, 2 months.
Tell me how it was like for you.
It was like hell. You can't go anywhere, you can't mix, you can't be with your friends, and a whole lot. The only thing you can do is to be in the house. There are times when you even go to fetch water in the borehole and there are people are there. Because of the urine scent, they will start moving one by one.
13,000. That's the number of women who currently live with fistula in Ghana. It's a condition that requires huge amounts of money to repair. And yet, Ghana's health insurance, a scheme that is already overstretched, does not pay for its repairs. And in areas like this where poverty levels are high, victims of fistula are left to their fate, living a life of exclusion and loneliness.
Cynthia has brought us to the outskirts of Garu, some 1 hour drive from Boko, to meet someone who has been living with fistula. We've come here to meet Mampuak Yaro. She's been living with fistula for more than 20 years. Mampuak's mother betrothed her to a man that she herself had refused marriage to. The man already had 8 wives. She's not sure what age she was then, but she says she had just developed breasts then, possibly meaning she would then have been in her early teens. She had her first 4 deliveries unsupervised at home. It was her faith that got complicated. And when she couldn't reach a professional birth attendant after 24 hours in labor, she lost her child and had to end up with fistula.
I was in labor for 2 days and I had to struggle to give birth on my own. In this town, if you go into labor and you're not able to deliver on your own at home, they say you are not woman enough.
So what happens to a lot of the women who are living with fistula in this community?
No one helps you, so I only farm to eat.
The story of fistula victims goes to show how healthcare delivery in Ghana marginalizes the poor and most vulnerable. A backlog of at least 13,000 women are waiting that some way, somehow, help would reach them to have their own surgeries soon. How long they would have to wait, nobody knows. Justice Beidou, JoyNews, Boko.
Very touching indeed. Justice Beidou, the man who put together this documentary, joins me in the studio. Justice, you went to the Upper East and Upper West, and we know that this is basically due to lack of supervision during pregnancy and childbirth. Did you find any peculiarity in the places you went?
Yes, so I mean, on the field, the causes are, the conditions are virtually the same. You have many places where people live like 10 kilometers away from the nearest healthcare facility. And so when women are pregnant, for example, they find it difficult getting access to some of these facilities. 1, the roads are bad. 2, there aren't vehicles that are there to ply this roads. And even when they've struggled to get to these centers, most of the time there are no officers working at these centers. And so and again, these are women who, most of whom have begun sexual activity very early, and so fistula basically develops as a result of women conceiving and the birth canal basically not being ready to undertake the process of delivery. And so the pressure that they go through to deliver requires that someone, a skilled birth attendant, supervises their labor. And in many of these instances, women do not have access to some of these things. The big problem, which this documentary explores, is that every year 1,300 women are estimated to be diagnosed of this condition.
That's
and yet,
a very whopping figure.
And yet, because one, there aren't enough trained surgeons for fistula repairs, we are only able to repair just about 200 of them. And so we are leaving behind more than 1,000 women yearly who have fistula, leaking urine, feces, and yet have nothing done about it.
I'm sure it was very pathetic or sad, you seeing people going through this situation. How do they manage their everyday, day-to-day life?
It's terrible. One of the women I spoke with, I asked her a straight question: how does it feel like to live with fistula? She had just one word, and he said hell. You basically cannot do anything with anybody. She said you can go to the public pipe borehole fetching water. You go there, you have 10 people standing with you. Within 5 minutes, everybody is gone.
It's vanished.
And it's only because you are smelling of urine, you are smelling of feces. Nobody wants to be with you. Your families desert some of these people. Their husbands divorce them. Sometimes they are blackmailed. They are told they've cheated on their husbands. The reason they've been punished with such conditions. And so it's a horrible condition, and the fact that nobody is talking about it is even the bigger problem, which is what this documentary seeks to highlight.
And many of these people have children they're taking care of too?
Yes, and so
some of them breastfeeding?
Yes, so sometimes you have some who have children who need even more attention, and having to deal with the stigma that is attached to fistula itself,
and raising
has problems with and raising children. And so you could imagine how difficult it is for the parents and also for the children who have to grow in these in these circumstances. And so it's an issue that really needs to be spoken about, and the condition, the things that cause it really need to be dealt with, one of which I think is why we have a national health insurance scheme that does not pay for fistula repairs. It's
a bizarre
story.
You know that we normally talk about early sex marriage or early sex life or early marriage. You've spoken with some health experts. Has it got any link to this kind of
yes, exactly. It has, and which is one of the other things that this documentary also explores, is the availability of family planning options for women especially, and young people. A lot of these places, women do not have a choice over when they want to give birth, how many children they want to give birth to, and even who they want to marry.
The moment your husband wants it, you have to give in, and you have no control.
And so yes, and so whether there is you are prepared to give birth or not, you are giving birth. So people do not have options as to family planning methods.
And then a lot of the times they don't even go for pre-examination with the health experts for some advice before they even get pregnant.
A lot of myths, beliefs about all of these family planning methods. And so some of these do not work at all in some of these areas. And some of the things we end up having is conditions like fistula.
But there's some interesting news. Ghana is seeking to end child marriages by 2030. Currently, 1 out of 5 girls are married off in the country, especially in the rural areas. According to UNICEF, though the figure is an improvement from previous years and also an achievement compared to other countries on the African continent, Ghana can still do better. Country Representative Susan Namondo, who was speaking to JoyNews at the launch of the National Strategic framework on ending child marriages on Ghana highlighted the need for government to resolve the clash between norms and laws on the issue.
Framework is looking at what everybody has to do. The communication has to go out to the various authorities in the more decentralized areas, the traditional authorities, to enforce the laws that have been passed.
I'm casting my mind back, and I think some of these you have mentioned as parts of the strategic framework has been done already. So how differently will it be done this time to ensure that at least there's enforcement and it doesn't just lie there in the papers?
Well, two things. One thing, yes, some of these actions have been happening before, but I think the framework ensures greater collaboration across the different ministries. So a lot of these things have been happening, but there's not been one pulling all of these actions together under one framework. So now there's better. It's better, so there will be better coordination. That should make sure that the synergies are better and that we can actually get to the goal.
Let's talk about success with regards to the others on the African continent. How well are we doing with regards to child marriage on the African continent?
I think Ghana has recorded one of the fastest rates progress on the continent. So Ghana is doing relatively well, and part of that, I think, has been that, there's been concerted action. You have a constitution that speaks very clearly about some of these things. You have laws, you have a legal framework in place that makes it very clear that these are things that are unacceptable, and Ghana has grown economically a lot in the last years. So all of these things have helped move those numbers from 1 in 3 to 1 in 5, but more can be done. There's still tradition and norms driving some of child marriage, but a bigger proportion of what's driving child marriage is economic. And that's fortunate in a way. If it is economic, if you fix the economy, you give people options, you give people opportunities, you make sure that young girls have better opportunities, the problem will disappear.
Regardless of the norms and culture that you talked about?
What I'm saying is norms and culture does play in child marriage, but I think the economic aspect is bigger in the case of Ghana.
In 2016, a national campaign to end child marriage was launched by the Ministry of Gender, Children and Social Protection. According to the Gender Minister, Otiko Afisa-Jaba, there need to be better implementation of the policy and strict enforcement of law, an agenda the National Strategy Framework will solve.
It's a new beginning for all of us, a call to action to ensure that we reach all the parts of Ghana, across the 10 regions, all the districts and communities, to preach this gospel that it is dishonorable to let your child get married before 18.
So you sound very passionate about going into the field itself, not necessarily just sitting down and talking about it. How differently are you going to tackle this with regards to the framework that has been launched?
We have a lot of laws. The Children's Act was passed in 1998, F-Cube was in 1992. We have the gender law, we have the gender policy, the social protection policy, we have the child and family welfare, the justice for children. All these laws are available to change our lives, but it's in the minds. The change of attitude has not taken place, and that is what I'm talking about. My predecessors from Mama Gladys Asma to date have done a lot of work in terms of the various policies, but now the call for action is for enforcement and implementation.
How will you be doing that?
We are going to go down. I'm a grassroots person. The ministry is going to use aggressive new ways and approaches to ensure that we don't just sit and do the workshops. The workshops have a role, but now we have to have meaningful effect on the people. The NCCE, what are they doing about it? The information services, what are they doing?
Enforcement has been a bane to this setback to this child marriage issue. This time around, how exactly are you going to enforce the laws regarding the older men who go in for these children, and even those who go and just get these children pregnant?
Right from the grassroots, we're going to use more aggressive media. We will use the information services, they also have the film and the videos to go around the communities. We use story time. The NCCE will be part of it. The Ministry of Education will be part of it. Ministry of Health, Ministry of Culture, and chieftaincy, the various chiefs. Each time we go on the familiarization tour that I've started, we meet with the chiefs, and it's always an issue that we talk about. In the Upper West and the Upper East, they have all agreed, the chiefs and queen mothers, that they will come on board to help us to stop this menace. They all see that it is of no use to Ghana.